Hi everyone, Julie from Who Gives a Cluck, and this is Ellen who is suffering from egg yolk periodontitis. The most obvious symptom is this very engorged belly full of fluid. This is where the yolk doesn't keep going down the reproductive tract and make an egg, it leaches into their tummy. So she's got a massive tummy here. So I'm going to be drawing some fluid from her today, and just wanted to show you, certainly this is only something you do if you're absolutely comfortable doing it, or if you live near me, bring your sick hen to me and I'll certainly help you. You can see she's already been done before because we're a little bit purple in the area where we do take the fluid. It's off to the right. They always take the right side because there's no vital organs there that we can hit. First of all, making sure we disinfect either with citrogen or hydrogen peroxide is a good way to go. Wearing gloves, keep yourself all nice and clean, and let's just see what we can actually draw from her today. You would wrap her in a towel. She tends to be quite gentle, but you wrap them in a towel so they're secure if you need to. And off to the right side, you know, like at least 5 centimeters below their vent and off to the right. I'm using a thicker gauge needle this time, but you can use 18 gauge down to 14 gauge, especially when it gets a bit glunky, you know, all the fluid that's inside of them. So then when it's in, you just start drawing gently. You can draw, you know, well, pretty much you could take up to a cup of liquid from a hen, but I'd probably suggest don't take it all that's in their tummy, but you just take enough to give them a bit of ease. So I do that just when they're needing it, maybe a couple of times a week, just depends on the hen. Maybe once a week I put them on a broad spectrum antibiotic as well, so that it can help, and also painkiller where necessary. So just to give you an example, I won't keep going with this, but there's the type of liquid that you would be getting out of her. I'll just do that for today. Typically though with her I would certainly be drawing probably about 5 syringes like that, and that's about it. It's the best we can do. I find that when they get to this stage, it can happen at any age, egg yolk periodontitis, can't it, sweetie? But more typically as they get a bit older and their reproductive system gets very tired. I believe from all the hens I've worked with, it's the most common way for the girls to die. There's so many symptoms you get from it: the big belly, the ruffled feathers, the droopiness, they're hiding away from other hens. It's very painful for them. So if you think you've got a hen like that, most vets would suggest euthanizing them, and I would tend to agree with that, unless you've got someone near you or you're near me and we could help drain them and give them antibiotics. I've been fortunate enough to be able to save maybe 2 out of 10 this way, but at least prolonging their life a little bit, and also making sure if they do go, it's not in pain. This is just an extra take on Ellen. I've continued draining her. Look, sometimes the liquid can vary. In this particular case, you may not see it. I'm leaving the needle inside of her because she's got more to draw. You don't want to keep taking a needle in and out of the hen. But not sure if you can see there's little globules in there, which means that the liquid is, you know, in some cases it can almost get like cooked egg in their tummy, and that's probably, well, has very likely gone too far. Egg yolk periodontitis. This is what happens when hens, you know, are made to lay so many eggs, really. Bye for now.